Hello, and welcome to Nursing News You Can Use live at 5. I'm Tina Baxter, your host, and welcome to this Wednesday, July the 23rd, 2025. So excited to be here. Let's start off with our affirmation for today. Those who achieve success share one key thing: the belief that they can be, do, and have whatever they set their minds to accomplishing. That is our affirmation for today from the You Are a Badass calendar from Jen Sincero. Let's get started into the news because I can't wait to get into it. There's a lot going on in the world today. So, a little bit in the political realm here. It's coming from Healthcare Dive, a bastardized program. GOP lawmakers eye Medicare Advantage reform. A number of Republicans criticized Medicare Advantage during a congressional hearing on Tuesday, suggesting that the privatized Medicare program could be due for an overhaul from Washington. Calls to reform Medicare Advantage for Democrats are nothing new, but members of the GOP condemning MA, which is Medicare Advantage, is notable given the party's traditional support for the program in which the government contracts with private insurers to manage the care of Medicare enrollees. Medicare Advantage was created with the hope that it could save Medicare money while improving outcomes. But critics say that the program has spiraled out of control amid growing evidence that Medicare Advantage costs the government significantly more than traditional Medicare while restricting health care for American seniors. And so there's been a lot of backlash against Medicare Advantage plans. I know there's been some scrutiny over whether or not they're actually providing the value that they say they will. And just as an anecdote, I've had some clients that when they switched over from traditional Medicare or to one of the Medicare Advantage plans, they had trouble getting some of their medications that they wanted, finding people that were in network. So it's very confusing to a lot of people when it comes time to choose whether or not they would take Medicare and what type of Medicare. So we have individuals out there, brokers who can help you make those decisions, but it's becoming even more complicated for the average person to figure all of this out. So, given that, think about what's happening here in Congress. But let's go on. What the story says Representative Mike Kelly, Republican from Pennsylvania, we all recognize that there's a problem. He said during Tuesday's joint hearing of the Health and Oversight Subcommittees of the House and Ways and Means. It's people's health and it's critical. During the hearing, lawmakers criticized high rates of care denials and prior authorizations put in place by Medicare Advantage plans. They also aired concerns about inflated spending in Medicare Advantage, much of which stems from a practice called upcoding, in which insurers exaggerate their members' sicknesses to generate higher reimbursement from the government. The federal government is set to spend $84 billion, that's billion with a B, more on Medicare Advantage enrollees this year than it would if those same patients were enrolled in traditional Medicare, according to Congressional Advisory Group, MedPAC. Can we work with the insurers, work with CMS, work with MedPAC, work with my Democrat brothers and sisters, my Republican brothers and sisters to get incentives aligned, said Representative David Schweikert, a Republican from Arizona, the chairman of the Oversight Subcommittee. This isn't a game. This is one of the biggest things in our government. So major Medicare Advantage payers received the brunt of the flack at the hearing, which lawmakers, and particularly calling out, you guessed it, United Healthcare, the largest Medicare Advantage payer with 8.2 million beneficiaries. United Health own insurer is at the center of concerns about upcoding amid a flurry of media reports detailing how the company may have pocketed billions of dollars from the practice. Witnesses at the hearing included CEOs of smaller Medicare Advantage payers, including Alignment Health Plan and SCAN. Lawmakers praised the companies for focusing on quality and value instead of squeezing out profits from the program like some of their larger peers. I applaud y'all for doing right, said Representative Greg Murphy, Republican from North Carolina. What I like to see is United Healthcare, Humana, and Aetna sitting in front of us because they have bastardized the system. Still, Republicans acknowledge that it may be difficult to tweak Medicare Advantage given its popularity with seniors and the promise of improving quality and saving money at the program's core. I believe we can protect the integrity of Medicare Advantage while ensuring it remains a strong option for beneficiaries, said Representative Vern Buchanan, Republican from Florida, the chair of the Health Subcommittee. The Better Medicare Alliance, the main lobby for Medicare Advantage payers, told lawmakers to tread carefully in a statement in advance of the hearing. As Congress considers the future of the program, we urge policymakers to prioritize thoughtful reforms that strengthen Medicare Advantage while protecting the affordability, benefits, and coordinated care the beneficiaries rely on, said BMA CEO Mary Beth Donahue. If policymakers opted to reform Medicare Advantage payment, a sensible goal would be to align Medicare Advantage payments to plans with the cost of covering similar enrollees under traditional Medicare, said Matthew Fiedler, a senior fellow at the Brookings Institute Centers on Health Policy during the hearing. The most important step would be to fix Medicare Advantage's broken risk adjustment program, he added. Congress should tackle risk adjustment, health plan witnesses agreed, though they warned legislatures against across the board changes that would tamp down reimbursement for all managed care companies, not just the worst upcoding offenders. Congress should also focus on streamlining and automating prior authorizations and improving transparency around care approvals and denials, witnesses said. And that's always been a big problem because on the provider side, I see where they deny things because, we want you to try this instead of that. You haven't been on this long enough to do that, not taking into account that maybe there's a reason, and so you have to go through all these hoops to try to get an approval. That means there's more administrative costs on your end, and we wonder why healthcare is going up because there's more and more layers that gets piled on every time. The hearing suggests that curbing bad behavior in Medicare Advantage has evolved into a largely bipartisan issue, even though Republicans ignored calls from Democrats to tackle upcoding in the GOP's so-called Big Beautiful Bill that President Donald Trump signed into law earlier this month. Lawmakers on both sides of the aisle have introduced legislation to reform Medicare Advantage. Most recently, on Monday, Representative Lloyd Doggett, a Democrat from Texas, joined Murphy in introducing a bill that would require Medicare Advantage plans to pay providers at least as much as traditional Medicare does for care. Still, many Hill watchers don't expect meaningful healthcare legislation, given the GOP's recently passed tax and policy law includes upwards of $1 trillion in healthcare cuts from significant changes to Medicaid and the Affordable Care Act. So we'll see what happens. Keep an eye on this. But head on over to Healthcare Dive if you want to hear and learn more about this. Have comments? Let me know. All right, let's head on over to another story here. And this is from WYPR. And it says Baltimore St. Agnes Ascension nurses to go on strike Thursday. On Thursday morning, nurses at St. Agnes Ascension Hospital will not report to work. Instead, they will be picketing outside demanding safer practices for staff and patients. The strike will run from 7 a.m. Thursday to 7 a.m. Friday, and it's the culmination of 18 months of failed negotiations between the nurses' union, National Nurses United, and management at the hospital. The two parties have been at loggerheads for 18 months trying to hammer out a bargaining agreement. The nurses are demanding better nurse-to-patient ratios, an end to the practice of assigning nurses to wards where they do not have expertise, and a stoppage to patient assignments to charge nurses so they can better resource nurses they are managing. We are experienced nurses leave our hospitals and the nursing profession altogether due to working conditions at St. Agnes, said Robin Buckner, a registered nurse on the vascular access team. We need to stop the exodus of nurses by improving nurse staffing. When we have too many patients to care for, patient outcomes suffer. It means patients are waiting for pain medications, waiting for a nurse to answer their call light, or for assistants to get out of bed. This is why we are fighting for safe nurse-to-patient ratios in our contracts. The hospital contracted with a staffing agency to fill positions during the strike. This strike not only undermines the progress of negotiations between St. Agnes and NNU, but also creates unnecessary hardship for our associates and their families, as well as concerns for our patients and their loved ones, a statement from the management said. St. Agnes would prefer not to utilize these extended contracted services. However, we must make every provision to ensure the health and safety of our patients, families, providers, and associates during NNU's short-term strike. So I have to say this. And I know there's a big debate because when there's a strike, that does happen. They do contract out with agency nurses. Well, that's going to be important because you're going to have somebody to take care of the patients. And so there are some nurses that consider the agency nurses that come in as scabs, basically. But it's a little bit different than if you're making an auto part as opposed to taking care of a patient that's in critical condition and needs nursing care. It's not like we can just stop working, not take care of the patients. And so I want to know your thoughts on this because I think that as a nurse, if there was a place for me, I would want to know that I'm in a way that's kind of supporting you while supporting yourself, but supporting the other nurses by taking that load temporarily so that they have the freedom then to strike and negotiate for better conditions. So I think it's a way we need to think about this in healthcare because I'm seeing as more and more strikes happen, we've been covering them since we started the show. And I'm just wondering, how are we going to navigate this? And my other question is, knowing that these are things that are happening all the time now and the current state that we are in healthcare, I just wonder if these hospitals are doing the right thing by not addressing those issues, by letting it go out this long. I mean, obviously, these demands aren't egregious, not floating to a unit where you don't feel comfortable because you don't know how to take care of the patients. That's a safety issue. Making sure that there's adequate staffing so that you're able to care for the patients appropriately, and if you're in management and the charge nurse to actually be the charge nurse and do the job of the charge nurse. I think we've gotten so far away from what the nursing aspect of care should be that we're just looking at numbers on a page and we're forgetting that there's a big human element to this. And so I would encourage those in the bargaining units and those in the C suites, get together and think about this and think it through. This impacts real people's lives and not just the patients, but also your staff. And you can't treat people like they're robots. You can't treat people like they're widgets. They have needs and wants too. So just think about those things. So as these things go on, we'll be reporting on them. Let's move on to our next story. Okay, so this one, I can get it open up. There we go. This one's coming from Ignite Senior Living, and it says consumers paid price for private equity investment and private duty nursing report finds. The private equity business model could exacerbate staffing shortages and compromise care for patients with complex medical needs who rely on private duty nursing, according to a report published Tuesday by the Private Equity Stakeholder Project. PESP, as it's called, PESP, call for stronger antitrust enforcement, limitations on debt financing and healthcare acquisitions, and the expansion of paid caregiver programs with robust oversight to ensure accountability and protect patients. Our research shows that private equity's debt-based business model and focuses on outsized returns create risk for some of the most vulnerable patients and their families who rely on private duty nursing agencies. Mary Bugby, healthcare director of PESP and author of the report. Agencies saddled with excessive debt may rely on cost-cutting measures that exacerbate staffing and low wages for nurses, ultimately compromising the quality and accessibility of care. PESP noted that private duty nursing involves more individualized and continuous skilled nursing care than other types of home care. The sector is burdened with persistent labor shortages and low Medicaid reimbursement rates in many states. Even within this context, private equity's investment illustrate that investors see opportunity to make money in private duty nursing. While private equity investment activity in home health has fluctuated in recent years due to the number of factors, including the COVID-19 pandemic, labor shortages, and more recently, rising interest rates, firms have consistently invested in this space and play an outsized role. Cited a 2023 report from the American Antitrust Institute and Americans for Financial Reform that found that although PE accounts only for 6% of total ownership in the U.S. home care space, a significant portion of private equity home healthcare is concentrated in the hands of just a few firms. A more recent report from AFR estimates that private equity accounts for roughly 10% of home health and home care sector. So let's think about this, because as things are getting kind of dire in the nursing home industry financially, Medicaid cuts are looming, and all those different things. Oftentimes, Medicare will also pay for some physical therapy as well as your Medicaid. And so now I'm seeing that there may be a shift then of looking to invest those dollars in home care agency as you take advantage of some of the new programs that are coming out. And that does raise some red flags and some concerns, given what we were just talking about, Medicare Advantage plans. What is this going to do in the home health care sector? So these are things that we need to think about, because again, the model for private equity is we want to make a return on our investment. We give you money, we reap the profits, and oftentimes after that we skedaddle. And that's what happens. So we've seen it happen with hospitals, we've seen it happen with nursing homes. Now we're looking at it in home health care. So let's think about this. Let me know what your comments are and what you think. So it says, let's go on. It says, immigration policy and Medicaid funding dash expectations of increased investment for the time being. However, according to PES, even so, several private equity transactions have taken place during the first half of the year. Among them, Abound Health acquired New Jersey-based Star Pediatric Home Care Agency. Avenia Health acquired Thrive Skilled Pediatric Care. Avid Health at Home announced acquisitions of Home Care Angels and Private Duty Home Health Care. WAD Capital Partners announced the creation of a new home health platform company, AutoCare, formed from the acquisition of MedTech Healthcare and its merger with Senior Helpers. Interesting. Okay. So families turn to Medicaid to pay for private duty nursing once they've exhausted their financial resources, PEST said. According to KFF, almost 70% of home and community-based services, which includes private duty nursing, is paid for by Medicaid. Without guardrails in place, investor-owned and other for-profit home healthcare agencies can legally siphon Medicaid dollars away from direct patient care as patients and their families struggle to find long-term, reliable, and quality nursing coverage. So we'll see what happens. It's with this story. Take a look at it and follow along with it at midnight. Okay, let's get into one more story before we take a brief break. Okay, this is a big one. This has been all over my feed. I have to share this, and it's not funny, but yeah, this is wild. Okay, this one is wild. So it first popped up, and I saw this from ABC4 out of Pennsylvania, and then there was a subsequent story that came out. So I'm going to share them both. So here's the first one. It says, police, imposter nurse had 20 different aliases, worked at multiple Pennsylvania health facilities. Let's get into the story. This is coming out of Washington, Pennsylvania. And it says, a woman is accused of using multiple false names to work at healthcare facilities throughout Pennsylvania and other states. State police in Washington, Pennsylvania say they discovered aliases during a traffic stop. Shannon Nicole Womack faces charges for allegedly using false names to work at healthcare facilities in Pennsylvania and other states. When authorities pulled Womack over on April 5th, she allegedly gave them 3 different names. One of those names revealed multiple active warrants in Georgia, Tennessee, New Jersey, and Indiana. As they continued their investigation, authorities learned Womack had at least 20 different aliases, along with 7 different Social Security number combinations, a criminal complaint states. Police fingerprinted Womack and obtained the name Shannon Nicole Robinson. At that time, they say it was unknown what Womack's real identity was. Washington County authorities processed Womack as Shannon Nicole Womack. Days after she was taken into custody, a search warrant was executed on her vehicle. Inside, police said they found multiple forms of identification, prescription medication, paraphernalia from different nursing and healthcare facilities, medical documents, and equipment and patient logs. So here's a list of the locations where Womack allegedly worked. Elder Crest Rehabilitation Healthcare Center, Allegheny County. Harmer Village Care Center, Allegheny County. St. Mary's Home of Erie, Erie County. Greenery Center for Rehab and Nursing, Washington County. Beaver Valley Healthcare and Rehabilitation, Beaver County. Sayre Healthcare Center, Bradford County. Oak Hill Healthcare and Rehab, Westmoreland County. Southmore, Southmount of Presbyterian Senior Care, Washington County. And then Connor View Nursing and Rehab Center, Allegheny County. Investigators say Womack was not a licensed professional in Keystone State. In addition, police say she was not licensed in any state as a medical professional. The nurses provide a very important function with regard to health care. These individuals were not only getting that level of care, they were also weren't getting the vital medication that was prescribed to them by their doctor because this individual was taking it, said Washington County District Attorney Jason Walsh. So it's twofold. So she was perpetrating not only a fraud, but not providing the care that was needed for the individuals in these medical facilities. The criminal complaint states that Womack appears on Georgia's Nursing Imposter Alert site. According to the report, the Georgia Board of Nursing said Womack has used identities of multiple nurses to obtain work since COVID due to multi-state licensing being accepted. So here's the thing. This is what I'm saying. Nurses, protect your information. And do a check. Put that nursing license in there and find something to protect your identity, because this is more and more we're seeing this. It's running rampant. And a lot of them were just going in there and getting the money because they're impersonating nurses. Okay? So Womack is facing a number of charges that include endangering the welfare of care-dependent persons. State police said this could have started in 2020 during the nursing shortage. During that COVID time, they got hit hard and they needed help. So it wasn't uncommon for these different residents, locations, agencies to reach out to host agencies to say, we need some extra shifts filled. That started in 2020, and it was such an easy transition. She just kept going after that. So that was the first story, but then there was a subsequent story, and let me get to that really quick, and then we'll go ahead and take our break. And this was a press release that was sent out. And it says, state police seeking help with ongoing investigation for fraudulent nursing practices. And here it is. To aid in the ongoing investigation, the Pennsylvania State Police Bureau of Criminal Investigation is requesting health agencies and the state to review their employment records due to an investigation of suspected fraudulent activities involving Shannon Nicole Womack. Womack is alleged to have used at least 10 different aliases to pose as a licensed practical nurse, registered nurse, and registered nurse supervisor at her rehabilitation and nursing home facilities in various regions across Pennsylvania. She is charged with securing the nursing positions through staffing agencies, by submitting fraudulently signed documents, and also by creating a false LLC to deploy herself to jobs. And this is what I'm saying. This has gotten bigger than what I thought, because now she created her own false business. She contracted with some of these staffing agencies to find jobs. It says reports indicate Womack worked at each of these jobs for only a short time. So she only worked for a little while, and pretty much people found out she didn't know what she was doing, and she ended up getting canned. The PSP is working with the Department of Health, Department of State, and multiple district attorneys in states in the ongoing investigation, because she still has to face charges here in Indiana and New Jersey. So this woman has been around. But here's the thing. Here's the aliases that she's been using in various parts of the state. This is just Pennsylvania. Shannon Nicole Parham, Shannon Nicole Abiola, Shannon Nicole Armstrong, Shannon Abiola Parham, Shannon Nicole Grimes, Shannon Nicole Womack, Shannon Nicole Lawson, Shannon Nicole Lefko, Shannon Nicole Robinson, Shannon Lee Lawson. So if any of those names match any employment records at a provider's facility, they're urged to contact PSP Washington at 724-223-5200. Okay, so if you're in Pennsylvania and you're watching this and any of these Shannons worked for you, you might want to check into that and get a hold of your PSP. All right, let's go ahead and take a break because that was wild. All right. Ready to turn your nursing skills into a thriving business? At the Nurse Shark Academy, we give you expert strategies, real startup guidance, and the support to go from employee to empowered entrepreneur. Join us and build the nurse owned business of your dreams. Start today and join us at the nursesharkacademy.biz. All right, let's get into our next story here. Okay. While we're talking about nurses being bad actors, I did want to share this because this is close to home. And again, I am not trying to call out any particular nurse that has a problem, but I also want to highlight some things of what not to do. And this is why I share these stories a lot of times, because it's not my intent to bash a nurse that's going through and struggling. Anytime there's a problems with substances or anything like that, or mental health crisis, that's not what I'm doing. I'm doing this for education. So I'm sharing this because I want you to know what not to do. Okay. So this is from WRTV, yes, right here in Indiana. It says nurse agrees to surrender nursing license following WRTV investigation into fraud. An Indianapolis nurse has agreed to permanently surrender her nursing license following an RTV investigation into allegations she diverted medications meant for patients. Debbie Armstrong pleaded guilty to obtaining a controlled substance by fraud or deceit. As part of her probation, Armstrong can't use illegal drugs or controlled substances and must submit to drug screenings. She's been charged with interference with medical services, a level 5 felony, obtaining controlled substance by fraud or deceit, level 6 felony, failure to make, keep, or furnish records, a level 6 felony, and furnishing false or fraudulent information, level 6 felony. Armstrong also agreed to permanently surrender her LPN license with the state of Indiana, records show. As part of the plea agreement, the Indiana Attorney General's office agreed to dismiss the following charges: interference with medical services, level 5, failure to make or keep furnished records, level 6, and furnishing false fraudulent information, level 6. So she's worked in hospitals and nursing homes, most recently at the Waters of Indianapolis on South Keystone Avenue. Armstrong was accused of diverting drugs meant for patients at the Waters of Indianapolis. An investigation by the Attorney General's Office Medicaid Fraud Unit found Armstrong responsible for 19 discrepancies involving controlled substances like oxycodone and hydrocodone during the period from January 6th to January 17th in 2024. The Waters of Indianapolis terminated Armstrong for attendance issues, records show. Outside a Marion County courtroom on May 13th, Armstrong denied taking medications meant for patients. No, I did not, Armstrong told WRTV Investigates. I have to investigate this. I have kept my records so I know what I did and didn't do. Court documents list 6 nursing home residents as alleged victims, including Lena Galati, Gail, and I'm sorry, I know I'm going to mispronounce your names, but Meladendorf, yeah, is the daughter of Linda Galati, a former resident of the Waters of Indianapolis. I am disappointed that the Attorney General's office did not reach out to the victims' families before an agreement was reached for another slap on the wrist for Ms. Armstrong. I'm thankful that she will no longer be allowed to continue nursing, and I pray her community service doesn't involve being around any elderly or people of vulnerability. Meladendorf says her mother suffered from anxiety and depression. She was taking medications for that, which did keep her a little calmer. Records show Galati was supposed to receive 0.5 milligrams of clonazepam for anxiety on January 9th, 2024. Armstrong pulled the pill but noted that the pill was dropped. There was no documentation that she gave another pill to Galati. I think I was shocked, said Meladenoff. She goes on to say neither the nursing home nor the state notified her about what happened. I found out from you, Kara. You sent that email. That was the first I've heard of it. Nobody contacted me. I felt like I should have known. Galati died on January 29th of 2024 from congestive heart failure. But this is the interesting part, because I thought, okay, well, she has a substance abuse problem. Obviously, she should probably do some therapies and rehab. But then we go back to this. WRTV investigates uncovered that this is not the first time Debbie Armstrong had admitted to fraud. So it says in 2022, Armstrong admitted to license renewal fraud by making false statements on her application. Armstrong also failed to disclose that she was terminated from her job in 2019 for absenteeism and not following notice policies. In 2022, the Indiana State Board of Nursing approved a settlement agreement with the state and Armstrong, in which Armstrong agreed to pay a $1,000 fine. The next year, in 2023, she started working at the Waters in Indianapolis. I had to pay a fine. That's as easy as it gets, Armstrong told WRTV. Armstrong's 2022 settlement also includes mitigating circumstances, including that Armstrong completed a 5-day rehab program, participated in recovery meetings, and completed a MAD impact panel as part of her pre-trial agreement requirements. So here's what the Indiana State of Nurses Association says. So Katie Felly sits on the Indiana State Board of Nursing meetings. She's the chief executive officer at the Indiana State Nurses Association. And she says a $1,000 fine is common for renewal fraud and that some mistakes on license applications are unintentional. She says allegations of drug diversion are on the top issues brought before the nursing board. The Indiana State Nurses Association recently aired a podcast about how nurses get help with addiction. They are high risk because they have access to medications. So the patient is scanned and the medication is scanned to make sure they get the right medication. There are 5 rights for medication administration. We all know them: the right patient, right medication, right dose, it's given at the right time, and right route. Bailey said documentation is really important, especially with narcotics or scheduled medications. It's important to have 2 nurses signing off on that, so it's a red flag if there's a mix-up between the 2 nurses. Haley said the state is experiencing a nursing shortage. She said patients and their families can ask at a hospital, nursing home, or healthcare facility to see their medication chart. She said drug diversion is difficult to get away with. It's truly a liability issue for the hospital or the long-term care facility if the patient does not receive the intended medication. I do believe through the safety measures and detection process, we do have a good handle on when individuals are diverting, and we do have a good system to help them get the help they need, help them retain their license, and keep them in practice. However, according to this, Armstrong says she plans to retire from nursing. They asked for a statement from the Waters of Indianapolis, and they never responded. So records show, though, that the Waters of Indianapolis Director of Nursing tipped off Indiana Attorney General's office about Armstrong in February 2024. Records show staff found her, quote, standing at the medication cart asleep, possibly under the influence, and licking her lips and picking at the skin on her face and arms a lot. So when she reached out to Armstrong in May, said she planned to continue nursing. She says she has retired. She told the judge that she is out of work and on disability. So just want to let you know, those are some things. Don't do those things. And these are things to look for when you're dealing with colleagues and you suspect something. Report it to your administration. Talk to your supervisor, and let them handle it. Okay. All right, let's get on to this next story. This is from nurse.org. And by the way, shout out to nurse.org. They do a lot of great healthcare stories. I love them. A lot of their stories are very interesting topics. And so this one talks about the looming hospital layoffs. Hospital layoffs escalate, impact spreads from support staff to nursing. Hospitals and long-term care facilities throughout the United States have recently reported workforce reductions that include nurses, aides, and other frontline healthcare staff. In the past several months, healthcare systems such as Providence Swedish UC San Diego Health and Kaiser Permanente, among others, have announced layoffs in response to financial pressures, increased operational costs, and concerns over future changes in reimbursement rates. Can I just stop here for a minute and say this? Have they thought about reducing some of the management overhead? Because a lot of organizations are really top heavy. You have a supervisor, a manager for every little thing, and directors, and And most of them don't actually do the patient care work. So eh, I think before you start taking away from patient care, which we already know is short staffed, we just talked about that. We already know. Why don't you look at some of those areas where maybe you don't need a manager so they can check their TPS reports that, from again, that's a reference to a movie. Uh, why can't we look at that? Because I think there's just too much on the management side. It's top heavy, and you have to pay all these high salaries. And does that really help with patient care? So let's get back into it. Providence Swedish, which operates in 7 states, recently announced a significant restructuring effort that includes the elimination of 600 full time positions. In Everett, Washington, over 100 certified nursing assistants, nearly one quarter of the CNA staff, received layoff notices effective July 11th. Providence has cited increased operating costs, the insurance payment delays, inflation, and expected cuts in federal reimbursement as primary reasons for the staffing changes. While the organization notes that registered nurses hiring remains steady, the reduction of CNA roles may place additional demands on existing clinical staff. U.S. San Diego Health, sudden reductions. U.S. San Diego Health laid off approximately 230 employees in June, including nurses, aides, and social workers. Like the people that actually do the work, do the care. Okay. All right. Staff and Clinical Nurses Association, excuse me, staff and the California Nurses Association have raised concerns about potential impacts on patient care and staff well-being. According to KPBS, the layoffs were reported to be communicated abruptly, prompting frustration among workers. Hospital leadership cited financial pressures and reductions in federal funding, but maintains that nurse to patient ratios remain in compliance with the California state requirements. Cleveland Clinic lays off targets support roles. Clinical hiring continues. Cleveland Clinic, a global leader in academic medicine, announced the elimination of 114 jobs in 2025, affecting a mix of administrative, non-clinical support, selective clinical support, and IT positions. The organization emphasized that direct patient care roles are largely unaffected and that active hiring continues in high demand clinical areas. Despite the layoffs, Cleveland Clinic remains focused on expanding healthcare access, particularly in the Mahoning Valley, and advancing education through innovative partnerships such as a quantum computing collaboration with Miami University. So it says, in addition to Washington, Providence has announced layoffs across multiple states. In Oregon alone, over 130 positions were cut, affecting both clinical and administrative roles, as reported by the Portland Tribune. Other notable systems experiencing workforce reductions include Kaiser Permanente in California, 42 RN positions cut in outpatient departments. Mayo Clinic, Minnesota, layoff notices issued to more than a dozen nurses. Memorial Care, Long Beach, California, 115 jobs eliminated earlier this spring. Peace Health or Pacific Northwest, 251 roles spanning out nursing and support staff. So here are some of the reasons that the hospitals give, as previously reported. Decreased Medicare and Medicaid reimbursement rates, delayed insurance payments, rising labor, supply, and operational costs, broader inflation-related financial pressures. As a result, many facilities are reevaluating how care teams are staffed, sometimes consolidating roles or reducing support positions while maintaining or even increasing RN hiring and select departments. So what does this mean for nurses? For bedside nurses and direct care providers, these changes may lead to expanded responsibilities and increased patient loads, raising concerns about burnout and quality of care. In response, some healthcare workers are seeking support through unions, legal counsel, or peer networks. Others are exploring opportunities for continuing education or transitioning to new roles within healthcare. As the healthcare landscape continues to shift, the profession potentially faces growing pressure to balance cost-saving measures with delivery of safe, effective care. Whether directly impacted or supporting colleagues through transition, it's being reported that many nurses are calling for increased advocacy around staffing standards and workplace protections. So I was going to say, with this current crisis with layoffs, perhaps this is a good time for nurses to be looking at alternative ways to act in the profession. And this is a great time for you to think about putting on your entrepreneurial hat and starting your own business because obviously it's not, people say, oh, go to nursing, you'll always have a job, but not always. And so now may be the time that we start thinking strategically about our careers and what our next thing is going to be. All right, so let's see. Here is our last story. We're going to take a brief break. Then we get to our last couple of stories because there's one that I really can't wait to get to with our Nurse Making a Difference story. So let's get into the next one after this break. Nurses, are you ready for more? My mission is for you to own your seat at the table of nurse entrepreneurship, gaining confidence, skills, and the freedom to live your life on your own terms. Assisting you in achieving your goals through tailored advice, continuous learning, and a collaborative approach is at the heart of everything I do. Stop being eaten alive. Come feel the sun. Be a nurse shark. All right, so let's get to our next story. It's coming from out of New York, and this, of course, is near and dear to my heart because obviously it's about psychiatry and psychiatric nursing. But anyway, CBS New York says nurses call for better staff protections at New York State-run psychiatric centers. Staff at New York State-run hospitals, psychiatric hospitals, are hired to help people in need of mental health care. But what if the job is putting their own health at risk? CBS News New York investigator Masa Saidi exposed violent incidents at the hospitals and found out what's being done to protect both patients and staff. The Office of Mental Health oversees New York's 24 psychiatric centers, of which 4 are so-called forensic facilities for individuals in custody. An OMH spokesperson said in a statement, OMH has a zero tolerance policy toward violence in our programs, and we take very seriously any assault on our staff or patients. We are constantly evaluating our workplace policies and procedures, utilizing the best available approaches to improve safety at our facilities and protect our workers from harm, something that is reflected in the small number of assaults on staff at facilities that collectively serve upward of 5,000 patients annually. Since 2020, the state's recorded 57 assaults, or roughly 10 a year. But the head of the nurses union, Wayne Spence, says it's much more common. Relying on data from a state system used to log potential workers' comp claims, he estimates that there are 2 assaults per week across the state on average. Last year, hundreds reported workplace violence, which includes assaults, threats, and aggressive behavior. Registered nurse Peter Schiffman, who worked at a state-run facility in Staten Island from 1999 until last September, when he was punched by a patient. And the morning of this attack on my husband spent 30 minutes talking him down, and they gave him an injection. Wife Erin Schiffman said he came out of his room and sucker punched my husband in the side of the face. She continued, for what I was told, my husband clenched both of his fists like this and went straight back and cracked his head. His injuries were so severe, he had to be placed in a medically induced coma. He almost died, Erin Schiffman said. And there actually is a picture of this. And so I'm going to go ahead and warning, this is graphic, but I'm going to go ahead and show the picture of him in the hospital because I think it's kind of important. So give me 1 second. And here's a picture of Nurse Schiffman. Just so you know that this wasn't being made up, okay? So the patient was arrested for felony assault. State records show that he had a prior conviction for attempted SA. Because of that, Erin Schiffman said he was at high risk and should have been placed in a secure care unit for violent individuals, not a standard inpatient facility. And that is a lot of issues right there, is that we have really potentially violent patients that are put in situations where there's just not a lot of supervision. I blame the state because that patient should have never been there. You can't let criminals into a hospital with people in the general population and without properly monitoring them. I will say that, but that's not what she said. But I'm just saying they're properly monitored. They deserve care. Don't get me wrong; they should get their care, but they also should be monitored. She says Peter Schiffen is now living with a traumatic brain injury, which makes it tough to even walk. I remember nothing from my assault or ever meeting the person who supposedly hit me. He said the ICU staff held it as a miracle. He says the patient ended his career. The pain now is something I have never imagined in my life. For me, I work just to get through each day. It is hard. It is startlingly difficult. Nurse practitioner Carl Ankra was slashed in the face without warning at a different state-run psychiatric facility in 2019. The patient, who was later arrested and convicted, allegedly smuggled a razor and turned it into a weapon. He went right there from the corner of my eye all the way through my left ear. And Cross said, if he had gone a little bit deeper, I would not be here today. In the wake of the attack on Peter Schiffman, OMH made major policy changes at the Staten Island Psychiatric Center. It says, since the South Beach incident, we retrained staff on risk assessment, ran monthly drills to ensure their readiness, established a critical response unit, and tightened our partnership with local law enforcement, among other safety enhancements. The state is also considering a secure care unit there for violent individuals who are not in custody. I'm going to go ahead and stop sharing. So the Schiffman family wants the policy to be implemented statewide. He says, do you know that when that patient that assaulted my husband was taken off the unit, the patients clapped for him to be gone because they were petrified for their lives? They were cowering in their rooms afraid. They clapped. Spence is calling for better intake screenings. The gentleman who assaulted Peter Schiffman, he fought with parole officers. He was violent with them, but no one looked at his background. He also wants immediate removal of violent patients and additional forensic like secure units. Every mental health facility used to have a forensic unit. The model that we're asking them for used to exist. And that is true. We used to have, I don't know if they still have them now. I haven't been inpatient in a while. We used to have areas where if they were out of control and not safe, that we can help them rehabilitate in a safer environment. And I myself have been assaulted working on the unit. I've been punched in the face by a patient. So again, these things are happening all the time, and unfortunately, workplace violence is a problem. And that brings up to this story here. This comes out of I can't remember where I got this one from, but anyway, workplace violence is driving physicians and nurses to exit. New report shows. A growing number of U.S. physicians, nurses, and medical staff are considering walking away from their jobs due to safety concerns, according to a national survey conducted by the Harris Poll on behalf of the security company Workada. The report, published July 23rd and dubbed the State of Healthcare Worker Safety, looks at a rising workplace violence in medicine and the toll it takes on healthcare workforce. 45% of respondents say that they are likely to leave their jobs in the next 12 months, and 2 in 5 say they have already considered leaving because of threats or physical harm. They surveyed 1,027 frontline healthcare workers, including physicians, nurses, and other staff. This is from Medical Economics. There we go. I had a feeling I could remember where it was from. And they've said that they've experienced, 61% said they had experienced violence from patients as well. More than 54% said they have personally felt threatened on the job. Healthcare workers dedicate their lives to caring for others, yet our research reveals that they're not doing enough to protect them. This is ultimately not just a safety issue. This is driving lasting impact in the industry. Violence exposure isn't equally distributed, as nurses were twice as likely as physicians to report being physically assaulted, 62 versus 29%. Women consistently reported higher rates of all forms of violence, and Gen Z healthcare workers reported the highest physical assault rates of any generation, 60% compared to just 19% among baby boomers. And I think one of the reasons for that is that people just respected nurses more back in the day. You know, people were generally, I want to say nicer, but there was an attitude of decorum that you had to have. You just knew that it was more of community focus, and you knew the nurse that was taking care of you, and so you went to church with that person, and you met them in the grocery store, just like teachers. You knew them; they were in your community and part of the fabric of your community. And we're not seeing that now. There's such a disconnect. So it says, despite rising violence, 77% of workers said their organization hasn't increased security in the past year. 41% described their current security measures as minimal. And basic symptoms like alarm buttons, visitor ID checks, or de escalation training are missing in many settings, especially in physician practices. Among those who work in doctors' offices, 61% said their workplace lacks panic buttons, and 44% said they don't have any access control or security badge systems. Considering this, healthcare workers overwhelmingly support increased security investments. 82% said they want their employer to enhance safety measures, and 84% said they feel safer if those investments were made. On site security guards, panic buttons, and weapon detection technology top the list of desired protections. The impact of workplace violence extends far beyond individual safety. More than half of the respondents say safety concerns were deterring people from entering the profession altogether. Nurses were the most likely to say that they plan to leave in the next year at 50%, followed by physicians at 39%. Burnout is also worse in facilities with minimal security. The data shows 66% of workers in those environments said they feel mentally or emotionally exhausted by their jobs, and nearly 3 in 4 says it takes a toll on their mental health. For an industry that's already facing critical staffing shortages, this kind of impact can't be left unaddressed, the report concluded. Enhanced security measures are not just operational improvements, they're essential investments in the healthcare workforce and ultimately in the quality of care provided to patients across America. Okay, all right. Okay, so let's do this really two quick and then two quick stories, and then we're out. Okay, and then some brief announcements. So it says this is from the University of South Carolina, and I want to leave you on a more positive note. I don't want to leave you on a negative note. Let's leave it on a positive note. Nursing a New Future, University of South Carolina, opening path for nurses with disabilities. People with disabilities remain vastly underrepresented in the healthcare workforce, but a new initiative from the University of South Carolina is looking to change that. South Carolina has one of the highest disability rates in the country. 1 in 3 adults in the state reports having a disability, but people with disabilities make up only 4% of the nation's healthcare workers. A program in the university's College of Nursing meant to fight this statistic just received funding from the Duke Endowment this month. It is designed to recruit and support individuals with disabilities who are interested in nursing careers. Susan Newman, an endowed health sciences professor at USC and founder of the initiative, said this is the best way to do that is to start early. We hope that this new program that we're starting to really begin with high school students who have disabilities who may have an interest in a career in health profession, hopefully nursing. These students have the chance to attend a summer immersion program on the USC campus where they can learn hands-on what it's like to be a nurse. Participants will receive training on clinical skills, accessibility tools, disability rights, and health equity in the College of Nursing state-of-the-art simulation center. This helps them really determine if this is something they could possibly do with the disability and what kind of accommodations are available just to maybe help people see opportunities that they hadn't thought about before. But it doesn't just include high school. In addition to the student program, the initiative also offers mentorship, and career development resources for current nursing students and licensed nurses with disabilities. Newman says that the strategy has positive mental and physical effects on patients. People with disabilities generally have poor health outcomes. They have higher incidence of chronic conditions. One strategy to help address that is to have a healthcare workforce that reflects the population that they serve. That's been shown to help reduce disparities in other populations. She says that this is mainly because seeing someone with their disability become their caretaker gives them a brighter outlook. Another key factor is that they're understanding of what it's like to be a patient. So congratulations on that program. I hope many success for that as we move on to our last story here, which is our nurse making a difference. So I thought about this and I said, I wanted to go ahead and share this. I want to actually show her face because she's beautiful for one. And whenever we're sharing our nurse making a difference, if they have a great picture that goes along with it, I want to share that because I want you to see them, know them, and do that. So let's share the screen real quick. And here we go. Here's our nurse making a difference. Nursing PhD alum becomes Oakwood University's first female president. Throughout her career, Gina S. Brown, PhD in nursing in 1999, has demonstrated tenacity and resolve. While earning her PhD at George Mason University, she balanced a demanding academic schedule, sustained a full-time job, and raised a young family. On July 1st, Brown returned to her undergraduate alma mater, Oakwood University, to take on a new historic role, the first female president of the institution. Look at her. I just think that's wonderful. And it's a nurse. That's the other thing. This is why I'm saying it. It's a nurse. Yes. Brown emphasizes a leadership approach founded on shared governance, rooted in a respect for every voice in the Oakwood community, students, faculty, and alumni alike. I want to hear from everyone, those who love their experience and those who didn't. Everyone's voice matters, Brown said. Nevertheless, she is clear that her foremost priority is to protect and respect students. Brown has served in the clinical, academic, and leadership roles while pursuing her PhD. Brown has worked as a nurse recruiter. She traveled frequently to the Philippines to recruit nurses back to the United States to address the shortage of nurses and to evaluate their educational level to assess that they were the same as those in the States. She went on to hold several notable positions, including serving as an investigative review board liaison at Washington Hospital Center, followed by faculty appointments at Washington Adventist University that evolved into leadership roles as associate chair, and dean. Brown also supported underrepresented students at a minority-serving college in Baltimore and played a pivotal role in restoring accreditation at a school in Massachusetts. She later served on the board of Loma Linda University in California, which led to a faculty role as associate professor and director of the Doctor of Nursing Practice capstone programs. She then became dean of the College of Nursing and Allied Health Sciences at Howard University, overseeing 1,500 students and 100 faculty. So she has a list of academic achievements and professional achievements. I just want to say congratulations to you, and I wish you much more success, Dr. Brown. Okay, that's the end of all the stories. Let's get on to some of the announcements. So next week, this is exciting. Woo! Next week, we'll be having our event, our break-free event. There's still time to get a ticket. Head on over to the NurseSharkAcademy.biz and sign up today. As always, we offer our education programs with Baxter Professional Services, healtheducation.com. You can head on over there for that. I want to thank you for tuning in. I will see you next week. Bye-bye for now. Oh, and if you're watching, don't forget to like and subscribe if you're watching us on YouTube and hit the notification bell. And if you're watching us on Facebook, leave us a like and a comment. Share this content. Thank you so much. And as always, if you have local events, oh, by the way, I do have one local event that I meant to mention. The Black Expo has been postponed to August. So the Anderson Black Expo has postponed their activities to August due to rain that's projected to be this weekend. It's supposed to be raining pretty much tomorrow all through Tuesday of next week. So just rain. So they've decided to postpone that event. All right. Bye-bye. See you next time.